If you're enjoying these videos, subscribe. Let YouTube know that I'm doing a good job by subscribing to the channel. Plus, you'll get notified when I have new videos coming out. And finally, if you're enjoying what I'm doing, give it a like. Just click on that thumbs up, and that way YouTube knows that you like it, and they'll pass it along to other people that might enjoy my content as well. I really appreciate it. Thank you again. Let's get started.
I would like to thank the Agricultural Training Institute for inviting me again to talk about herbs this time. This is for AgriTalk, and we will be talking about herbs production, processing, utilization, and a bit of a marketing. Okay, so but before we go ahead and before natin pag-usapan all of these things and all of these details, let me introduce to you Republic Act 8423, or sometimes we call this the Traditional and Alternative Medicine Act of 1997. So for those who were able to attend in our previous trainings before, facilitated by the Agricultural Training Institute, I'm sure you were able to hear about this already. So dun naman sa mga kakapakinig pa lang nitong program ng ATI about herb processing, utilization, and of course marketing, you can check this on the website. You can always Google this. Just look for Traditional and Alternative Medicine Act. So ito po ay batas ng Pilipinas, ibig sabihin Republic Act, which is advocating all Filipino citizens to be aware kung paano gamitin yung ating mga halamang gamot. So dito nakalagay yung 10 halamang gamot ng Pilipinas. So that means these are the medicinal plants, well studied, established by the Philippine government. Gumastos po ang gobyerno natin dito sa 10 halamang gamot na to just for it to be proven na nakakagamot siya. So some of those medicines, fortunately, are available in the pharmacies already. So nakikita nyo, mabibili nyo na siya sa mga pharmacies. Example is Labundi, meron din po tayong Sambong, no? So on and so forth. Okay, so today we will be talking about not only the medicinal plants, pag-uusapan din natin yung mga culinary plants. Okay, so ibig sabihin, ano yung nakikita mo sa kitchen mo? Like I always say, your kitchen should have medicine, no? I don't know if you're familiar with the phrase, no, na very, very popular, which is popularized by Hippocrates. It says, let your food be your medicine and your medicine your food. Unfortunately, many people right now, pag binuksan mo yung kanilang refrigerator, binuksan yung kanilang freezer, we're not really sure if the food you will see inside are food that will heal you, or oftentimes ang nangyayari, whatever is inside the fridge or the freezers are food that will require them medicine in the long run. Okay? So I hope this activity of ATI will be helpful for you, and I'm sure that there will be learnings as we go along in this 1 hour of discussion. Okay, so I hope you remember that. That is Republic Act 8423, or we call it Palma of 1997. Alright, so you will also see there in that Republic Act that we primarily use these medicinal plants for primary health care. So ibig sabihin, pag sinabing primary health care, these are basic and common diseases that people are suffering right now. Halimbawa, if you have colds, may ubo, may sipon, may lagnat, ano ba yung pwedeng ibigay sa ating pasyente? Ano ba yung pwedeng ibigay sa mga kasama mo sa bahay? Lalo na sa panahon ngayon, you don't have the easiest tawag dito, access to hospitalization. Hindi lahat pwedeng pumunta sa hospital. Kahit you can afford to go to the hospital, you can't easily be admitted, right? Dahil sa condition na meron tayo ngayon. And bottom line, whether this could be communicable disease or non-communicable disease, prevention is always our best option, right? Kasi in this time of pandemic, we can really see a very, very thin barrier between communicable disease and non-communicable disease in terms of prevention and management. So like for example, the CDC and the World Health Organization are looking at the presence of the pandemic right now in terms of fatality. Ibig sabihin, yung mga pasyenteng merong mga chronic conditions, ito yung mga non-communicable diseases, example, hypertension, diabetes, heart disease, or stroke, for example. Ito rin yung mga pasyente na which has higher chances of fatality. Ibig sabihin, if you get infected with COVID-19, mas mataas yung chances that you will develop a critical condition. But we have a very, very good news kasi kapag wala ka nitong mga sakit na to, that means you know how to take care of yourself, right? You know how to live healthy lifestyle. And you know how to use things that you can find in your kitchen as medicine. Ibig sabihin, you can prevent this. And if you can prevent chronic diseases, that means you can also prevent developing critical condition in case you will be infected with COVID-19. Alright? So, like I said earlier, this is for primary health care. So good if you have the access to primary care physicians like us. I'm a family medicine practitioner, so I usually see patients for primary health care. But if you don't have access to primary health care, like maraming barangay sa Pilipinas, na ang kanilang mga barangay doctors, they really seldom see their doctors, right? Kasi yung mga barrio doctor to the barrio natin, they cannot really visit your barrios every time, right? So ano yung pwede mong ibigay? Ano yung pwede mong gamitin na nasa bahay na pwede mong ibigay in case your family member will experience these chronic types of diseases, yung mga common diseases na meron tayo sa mga bahay. Okay? So, but let me introduce to you again the fundamentals of the utilization of these herbs. We have the what we call pharmacognosy, alright? So may tinatawag tayong pharmacology if this is utilizing drugs, the medicine na piniprescribe namin dito sa aming klinika. We also have pharmacognosy. Yung pharmacognosy, this is the study of these medicinal plants, medicinal herbs, and how do you utilize them, okay, for therapeutic purposes. So I just want to have a disclaimer here. I'm not being paid by any of the pharmaceutical companies who are selling supplements, food supplements, or herbs around. So this is practically for the purpose of community services and offered to you by Agricultural Training Institute. So in terms of pharmacognosy, dito natin pinag-aaralan kung paano piniprepare yung mga herbs, how do you utilize them, ano yung tamang preparasyon para makagamot siya, and so that it can reach the therapeutic level. So you have to be careful kasi maraming nakikita ngayon tayong mga blogs, marami tayong nakikita opinions and posts on how do you use medicinal plants, right? That's one of the problem we're facing right now in the medical community kasi nga these are uncontrolled utilization of medicinal plants. So that means it can pass through the FDA as food supplements, and then it has a label there nakalagay no approved therapeutic claim, right? Kasi it hindi siya dumaan sa proseso like and studies like that of the drugs na iniinom ng mga pasyente, and of course piniprescribe ng mga doktor. And these medicinal plants are readily available around. So it's really good and it's really nice for us to know kung paano natin siya gagamitin for the purpose of for therapeutic purposes, for example. Okay? So good thing is we have the guide, right? So in terms of the Philippine medicinal plants, the Department of Health, meron po tayong booklet, no? May booklet po ang DOH na pinamimigay. Libre lang po yun on how do you utilize those 10 medicinal plants. That means, paano mo siya i-harvest. In fact, the ATI is also teaching us on how to plant them, how to propagate them, and the Department of Health gave us the guideline on how to process them and how do we utilize them. And good thing, the ATI here is also providing us information on how do you go about marketing, because there are livelihood program inclination in terms of the utilization of medicinal plants. Now, going back to ancient history, I'm sure you're aware that back 5,000 years, if you try to look back history, makikita mo that herbalism is already there, herbology is already there, pharmacognosy is already there, phytotherapy, these terms that I'm talking about, nandoon na po siya. Okay, so dati kasi wala namang tableta, walang capsule, diba? Walang syrup. So people before are utilizing decoctions, dried herbs, no, or fresh preparations, extracts, poultice, for example, ointments, no, these types of preparation. And as we go along, you know, in this training, makikita nyo po kung paano siya ginagawa. Alright, so now in the modern utilization of these herbs, the World Health Organization have actually estimated that 80% of the population of some Asian and African countries are presently utilizing herbal medicine. Okay, now if you visit many other Asian countries, specifically China, for example, pag pumunta ka ng China, you go to Taiwan, most of, and Hong Kong, for example, and even Singapore, most of the medicine they use there are basing on traditional Chinese medicine. Tama po ba? Okay, so before they even use the drug, their primary care and the primary thing that they utilize sa mga sakit nila are traditional Chinese medicine. So you see, there is what we call cultural inclination in terms of utilization of these herbs. So now in modern utilization, there are a lot of medicines sa ating butika ngayon, sa ating pharmacies that you can see. We call this in the pharmaceuticals. Marami pong mga medicine which are based on plant substances. Okay, so examples are the opium, yung ating aspirin, digitalis, quinine, vincristine, and then steroids. I'm not sure if you're familiar with vincristine. Yung vincristine is a chemotherapeutic drug which basically comes from a plant substance as well. Okay? So, hindi po plainly chemical lang pinagigagalingan ng drugs. There are medicines that are coming from plant-based substances. Now, if you're familiar with pharmacopoeia, you will see there that there are about 7,000 medicinal compounds that you can see in the list of medicinal plants na meron sa buong mundo. Okay, so basically, a lot of these are being utilized in modern medicine today. And one of the good things is that we have this what we call, and I'd like you to be familiar with this, kasi these medications that are available in our pharmacies right now are basically based on the ethnobotanical survey. So, ibig sabihin, there are many researchers who are getting involved into surveying of these medicinal plants, and then eventually they end up in the laboratory, and eventually they end up in a pill form or tablet form. At ito na yung ginagamit ng ating mga pasyente ngayon na nire-reseta ng ating mga doktor. Okay? So here, the World Health Organization gave importance and value of traditional and indigenous medicinal herbs. Okay, so this is a basic campaign of the World Health Organization. In fact, through this effort, it has led to an appeal to all members of the countries in this effort. It has started in 1970, you know, to do their utmost to preserve their national heritage in the form of ethnomedicine and ethnopharmacology, and bring back the use of known and tested medicinal plants and derivatives into primary healthcare. The Philippines is involved in this effort. So that's why the late Senator Flavier actually facilitated this movement. That's why we already have the TAMA, which is the Traditional and Alternative Medicine Act of 1997. Now, this is a very nice guideline for Filipinos to use kung paano gagamitin yung medicinal plants, because again, ang daming information around, and unfortunately, this herbs right now is one of the largest industry in healthcare na nagiging multi-level marketing siya, so on and so forth. So, but again, if you can utilize some of the ingredients that you have in the kitchen, use them as medicine. Like I said, food as medicine, mas maganda. Okay, but again, before I go ahead and talk about the types of herbs that you can use, let me just remind you, these traditional medicinal plants are there to help us relieve the symptoms, right? But, example, garlic will help you with your cholesterol, right? But no matter how you take garlic, for example, every single day, kung yung kinakain natin externally are huge sources of cholesterol pa rin, it doesn't make sense at all. No? So parang gamot lang yan. Kahit bigyan pa kita ng simvastatin every single day, and then you keep eating cholesterol-laden food, then it doesn't make sense at all, diba? So you have to go back to the cause, you have to think about and review what are you taking every single day. Bakit ka ba umiinom ng gamot? Is it because you wanted to keep eating the same food, kaya ka umiinom ng gamot, or you wanted to get rid of the cholesterol? So remember, heart disease is progressive, right? It's the number one killer in the world and in the Philippines as well. Over 200 Filipinos are dying of heart disease every single day, right? And basically, that's because of the cholesterol we're eating from outside sources. So, remember, yung ating liver, nagpuproduce siya ng cholesterol. But the moment we eat saturated fats, ano yung saturated fats? We only find this in animal-based sources. Example, nakuha natin sa egg, meat products, for example. Sa vegetables, makukuha natin siya if we keep eating fried foods. Kasi yung saturated fat, you can find this in oils, right? Vegetable oil, for example. So you get the saturated fat. And this saturated fat will actually drive your liver to produce more cholesterol than it's normally producing. Okay? So, basically, ganun din. Aakyat din yung level ng cholesterol mo. And here you are, umiinom ka ng simvastatin, for example, in a drug component, or umiinom ka ng garlic, yung sa herb naman, na galing sa kitchen mo, pero kinakain mo pa rin yung saturated fat and cholesterol, it doesn't make sense. So, ganun pa rin, okay? Nandun pa rin yung cause. So, remember, we have to remove the cause if you wanted to achieve relief or give remedy to your disease. Alright, so going back to the herbs, we have many types of herbs. Okay, so like for example, sa mga drugs, marami tayong klase ng drugs, right? Meron tayong drug for headache, we have drugs for the digestive system, we have drug for many other systems of the body. So, ganun din po sa herbs. We have carminative herbs, we have laxative, cathartic, or purgative herbs. Meron din po tayong, let me go back to carminative, that means this is for the digestive system. Like for example, if you're suffering from dyspepsia or colicky pain, so sumasakit yung tiyan, ito po yung binibigay natin. And then we also have laxative, cathartic, or purgative. Ito yung mga patients who are suffering from constipation maybe, no? And then we also have diuretic, ibig sabihin pampaihi. And then we have analgesic for pain. We also have herbs which has antibacterial property, and we have many plant-based substances that has antioxidants property, and that's what we need in this time of pandemic, right? And then we also have pyretic para sa lagnat, and then expectorant. For example, your lagundi. Lagundi is a best example of being an anti-pyretic para sa lagnat, and at the same time expectorant. Okay, I'll give you examples of carminative. When we say carminative, these are herbs or preparation that will prevent the formation of gas sa ating digestive system. Okay, and this will facilitate expulsion of these gases. So that means for patients who are suffering from flatulence, no, nakakatulong siya. So carminative herbs mostly has essential oils, so they have really good aroma. So these are the example. And some of these are very commonly found in your kitchen. I'm sure you're familiar with basil, anise seed, we have cinnamon, we have eucalyptus, garlic, ginger, for example, your onion, orange, oregano, peppermint, your rosemary, your spearmint, thyme, and tarragon. Now, you might be asking me saan makikita yung ibang hindi nyo nakikita sa kitchen nyo. If you go to the grocery store, hindi lang kasi tayo familiar, we don't usually visit the condiment section. When you go visit the condiment section, hindi lang po betchin ang binibili doon at asin, hindi lang po paminta. Ang daming herbs na nakasabit doon, alright? So hopefully after listening and watching this seminar, pagpunta nyo doon sa condiment section, you will find your thyme, you will find your tarragon, and all of those herbs that can really help you specifically with carminative function. Okay? Now, next here is purgative, laxative, or cathartic herbs. So that means this will help you to relieve constipation. So when we say cathartic substances, this will accelerate defecation. Kasi yung iba nahihirapan lang dumumi. Everyday dumudumi naman sila, pero medyo mahirap lang. So we use cathartics. And yung iba naman, they cannot really induce defecation. So that means merong 4 days, every 4 days saka dumudumi. Then we use the laxative. Alright, so example here, we have, I'm sure you're familiar with nyog-nyogan. In fact, we use this also as purgative, no? For example, this is one of the 10 Philippine medicinal plants. Now, you can see in the figure now, meron siyang mga seeds. It tastes like nuts, no? Para siyang nuts. And then you just have to consume that. You will see here on how many seeds do you need depending on the age group. Okay? Okay, next here is diuretic or anti-lytic herbs. So these are natural diuretics. That means when you take this, pinapaihi ka niya. So this is good for patients who have hypertension or patients who have kidney stones or urinary tract infections. So remember, patients with kidney stones are prone to develop urinary tract infections then. So that means if you take these herbs, for example, this may help you urinate those bacteria na buhay sila kasi you're not using antibiotics, right? So basically, when a patient have urinary tract infection, we prescribe antibiotics, right? And then, like in my practice, I would prescribe antibiotics and then I would ask them to take some of these herbs which have diuretic properties so that we can flush out those dead bacteria or kasi ibang bacteria hindi naman talaga patay pa, no? And then some of those bacteria are still alive. And so we want them out of the urinary system. So example of this is, one of the most famous is sambong, okay? So among the 10 Philippine medicinal plants, sambong is really one of the famous. You can find this in the pharmacy. Ginagamit po kasi talaga siya for kidney stones because you know, kahit ngayon, a lot of drugs are in the market that we use for kidney stones, pero they do not crush the stones. Okay? They do not melt down the stone. Hindi nila tinutunaw yung bato. But sambong has that unique property. So that's why even doctors right now, urologists right now, internists now are prescribing sambong. Okay? So sa Ilonggo, ang tawag ay alibhon. In Bisaya, it's called gabon. Okay? So Tagalog, ang tawag natin ay sambong. Traditionally, it's used for fever, it's used for cough. So like I said earlier, the ethnobotanical survey, right? Dati kasi ang alam nila ang sambong para lang talaga sa ubo, sipon at lagnat. And then eventually, as they did the research, ang pinag-aaralan ni para sa ubo, sipon at lagnat, they found out that the patients are in diuresis, ihi ng ihi yung pasyente. And so they also studied other function of sambong. It turned out it is anti-lytic, tinutunaw niya yung bato. Other herbs that can be useful that you can find in other sources, we have got whiskers, we also have horsetail. In fact, yung buhok ng mais nakakatulong din po. They are very, very good diuretic at the same time. Okay, next here are the analgesic herbs. Pag sinabi natin analgesic herb, these are good substitute for non-steroidal anti-inflammatory drugs. Example, you've been taking paracetamol or ibuprofen, for example, for pain, especially for muscular pain. We have some herbs that will help you. Number one here is mint. So mint is one of the 10 Philippine medicinal plants that is really proven to help you with pain. So pwede siyang gamitin fresh na mint. If you take it by mouth, example, decoction or infusion, you will see later, when you see decoction, that means pinakukuluan mo sa tubig yung herbs. When you say infusion, hindi mo pinapakuluan, you just steep herbs on in the water. Okay? So if you take this through decoction or infusion, this will not only help you with your pain, with muscular pain, pero may carminative purposes din. May carminative property kasi ang mint. Okay? So like I always say, sana lahat ng household sa Pilipinas may mint because when you have headache, you can be helped with mint. When you have fever, when you have cough, when you have body pain, you will be helped with mint. Okay? So napakadali niya lang i-propagate. Cuttings lang, mabilis siyang dumami. Okay, and some of the herbs that can also help us is, example here is eucalyptus and of course cayenne. You will notice, please also take notice dun sa mga binibenta sa pharmacy natin or halimbawa sa grocery stores, you will see their pain relievers, yung mga lotion or mint or ointment, for example, or creams, that are used as pain reliever. Most of them, initially, you will feel malamig, right? Bakit siya malamig? Because of the menthol component coming from either eucalyptus or mint. And then next, you will feel is mainit. Why there is heat? Because that also suits the mint suits the muscles, and then the heat will actually help the muscles at the same time. So, yung heat is coming from the cayenne or the capsicum. A mixture of these three, basically, ito yung ginagamit na external application for pain. Okay? But if you want to take it internally, yung mint po nakakatulong sa atin. Alright? And of course, we also have sedative herbs. When you say sedative herbs, these are plant substances that will help you sleep. So, many people are having problem with sleep, especially in this time of pandemic, nasisira na yung ating body clock, right? So, these types of herbs can help you. Like I said earlier, nandito na naman po si mint. Okay? Mint is proven to help patients sleep. So, a dose of mint that are used as pain reliever, most of them, initially, you will feel malamig, right? Bakit siya malamig? Because of the menthol component coming from either eucalyptus or mint. And then next, you will feel is mainit. Why there is heat? Because that also suits the mint suits the muscles, and then the heat will actually help the muscles at the same time. So, yung heat is coming from the cayenne or the capsicum. A mixture of these three, basically, ito yung ginagamit na external application for pain. Okay? But if you want to take it internally, yung mint po nakakatulong sa atin. Alright? And of course, we also have sedative herbs. When you say sedative herbs, these are plant substances that will help you sleep. So, many people are having problem with sleep, especially in this time of pandemic, nasisira na yung ating body clock, right? So, these types of herbs can help you. Like I said earlier, nandito na naman po si mint. Okay? Mint is proven to help patients sleep. So, a dose of mint infusion at night, for example, can help you induce sleep. Now, one of the famous edible flower in this generation, we call it the butterfly pea or the blue ternate flower. This is really helpful for patients with problem with sleep or insomnia. Okay? So, other things that can help you are coriander. Basically, kung may available na coriander. And then lettuce. Romaine lettuce, yun ang may pinakamaraming substance that can help patients with insomnia. Alright, so now let's go to kitchen medicine. Now, when we say kitchen medicine, these are things or ingredients that you usually see in your kitchen na ginagamit natin to cook. Okay, so akala natin para lang sa ulam, for food purposes, but it has many functions at the same time. Now, let me just review what makes your food a medicine. Basically, it's because of the active constituents. Maybe it has phytochemicals inside, or maybe it has some of the alkaloids na helpful for the patient. We call this in general active constituents. And then it also has the vitamins, the minerals, enzymes, and then the water component at the same time. Okay? So, let's start here with cabbage. Alright. So, alam natin kasi sa repolyo, para saan ba niluluto ang repolyo? Pansit, no? For example. Or puchero, no? Nilalagay natin yan dyan. But, did you know that cabbage is an alkaline, what we call is an alkaline plant that can really help patients with stomach ulcers. But let me just warn you, if you cannot find organic cabbage, huwag na lang kunin yung extract, okay? Because what we want here for patients with ulcer are fresh cabbage juice that you can find in organic produce. So, kung walang organic produce na cabbage, you can use your cabbage for external purposes. For example, you have neuralgia, rheuma, no? Arthritis, for example, you can use your hot cabbage leaves, as topical application to relieve the pain. Okay, next here are the carrots. We know very well that carrots have very, very high sources of vitamin A, and then the carotenoids, it has antiseptic, anti-putrefactive, antibacterial property. It has lots of antioxidants. That's why we use your carrots to boost our immune system. We also use carrots for patients with cancer. But I just have to warn you, since carrot is rich in vitamin A, it's a fat-soluble vitamin. It's not readily excreted by the body, so they accumulate. So that means makikita mo naman kung sobra na yung intake mo ng carotenoids kasi you will turn orange, especially yung ating palad. Okay, when you see that, that means you're taking it too much. But basically, because this is an alkaline substance, it can help patient with heartburn, yung mga may reflux, yung acid umaakyat, akala nila may heart attack sila. No, we call this heartburn. This can help you as well. This will also help patients with constipation then. Okay, so how do you use this? This can be used in blended form. Say you prepare this as carrot juice. Juice meaning extract niya lang. We usually recommend that for cancer patient. Pero yung blended form, nakasama yung fiber niya, we also use this for patients with constipation. Okay, so next here in the list is tomato. So we usually use tomato panggisa, no, sa niluluto natin. But basically, tomato is really, really good for stomach ulcers at the same time, and patients with liver problem. Yung matataas na SGPT and SGOT has really, really good antioxidants, and that can help your liver, and that can soothe, you know, ulcers at the same time. So, but again, we're talking about fresh tomato here, ha? No? Hindi yung tomato sauce kasi it has added ingredients already and it is already in acidic form. Okay, next here is onion. Sino bang walang onion sa bahay, right? So, when we say onion, this will help stimulate mucus secretion. That's why it has anti-putrefactive activity. So, pag kumakain tayo ng karne, kumakain tayo ng manok, for example, we know maraming putrefactive bacteria ang animal products. It has millions of putrefactive bacteria. Kaya kung merong onion, for example, you take all the onions because it has anti-putrefactive effect. Now, traditionally, onions are also used for ear infection. So you will see this in ethnobotanical survey. These are traditionally used for ear infection. So ang ginagawa nila, dinidikdik nila yung onions and then they put it outside the ears, dito sa labas ng tenga. For patients with otitis media, ibig sabihin yung may mga lumalabas na mucus, you know, and pus sa kanilang ears. And for those patients na, kasi they started to use this with kids na naliligo sa sa mga sapa. And so they got water inside the ears, na-infect, and this is what they use. And so it will help soothe the pain, and it also helps with infection. So it has been used traditionally, and hanggang ngayon po ginagamit pa rin siya. Why am I telling you this? Because there are many areas in the Philippines na walang access sa mga ENT. Good for you if you have access for ENT, you go get consultants so they can give you antibiotics for your ear infection. Pero kung wala kang access, you don't have budget to travel, you can use your onions in the house and pwede mong gamitin. That can help you ease the symptom. Alright, so we also have ginger, diba? Yung luya. Basically, sa mga bahay, alam natin, if you have sore throat, ginagawa natin candy yung luya. If you have flu, for example, if you have hoarseness of your voice, na mamaos ka, we use ginger. Unfortunately, ngayon kasi, yung mga commercially prepared na ginger are mostly prepared with sugar. So basically, it's about 80% ginger extract and then, 20% ginger extract and 80% sugar already. Now, if you can make this at home, mas maganda. These types of preparation na commercially binibenta sa mga grocery stores, for example, these are good for people who has no diabetes. Pero kung may diabetes ka, we don't want the sugar in it. Okay? So, mas maganda kung ikaw yung gagamit. So, you can use decoction form, again, or infusion form of your ginger. Okay, now, in the next minutes that we will be talking about the 10 Philippine medicinal plants. Ito yung 10 halamang gamot ng Pilipinas. Okay? Now, you will see here, Acapulco, number 1. Okay, so your Acapulco or Palochina, if that's familiar with you, Uh, this used for external purposes. It's used for buni, an, alipunga, galis aso. Now, if you don't have money to buy the creams that we usually prescribe, kasi medyo mahal yung cream for the skin, right? Especially for fungal infections. So, you can find this plant. They can easily grow, I tell you. Pag may isa ka lang tanim, eventually, mabilis siyang dumadami. So, you only need the extract of the leaves of Acapulco, and then you just have to put it on affected areas twice a day, for example, for 30 minutes, then that's good enough. So, kung yung mga pasyente natin na they have wounds, for example, galis aso, right? So, these are scabies. So, they can be helped, especially if you use this with bayabas, no? Or guava leaves, because guava leaves has antibacterial property at the same time. So, you use this in decoction form as well. Pinakukuluan din siya, and then ito yung pinapaligo natin. I don't know if you remember this, but when I was a kid, I remember pag kami may mga sugat-sugat sa paa, naglalaga yung mama ko ng Acapulco or bayabas kung anong may available. And then, yun ang pinapaligo sa amin. Well, fortunately, it has helped us. And then, again, traditionally, it's being used. Culturally, it's used in many Asian countries. And the Philippines has been using it. Again, if you don't have access or budget para bumili ng mga creams na ginagamit natin, Acapulco is really helpful. Alright, next here is ampalaya. So, ampalaya, or we call this Momordica charantia, we know that ampalaya is very helpful for patients with diabetes type 2. Okay? So, it's been proven to help patients with mild non-insulin dependent diabetes. Take note, mild non-insulin dependent diabetes. This can help you. And for those patients na may iniinom na maintenance medication for diabetes, you have to tell your doctors na, Doc, nagtitake po ako ng ampalaya, so that they can advise you on what to do next. Alright? Next here is bawang, okay, or your garlic. So, here, garlic was proven to lower the cholesterol level. Take note, hindi po siya para sa hypertension. Kasi marami pong pasyente, usually in the emergency room, I also have exposure in the hospital, and I have duties in the emergency room as well. Yung mga matataas ang BP, usually pag ini-interview mo na sila, you can really smell the ahos, no? Ahos in Ilonggo, bawang sa Tagalog. You can really smell the garlic na iniinom nila or kinakain siguro nila, nginunguya nila as they go to the hospital, no? Along the road. Hopefully, hoping na bumaba yung kanilang blood pressure. So, your bawang is not for hypertension. Basically, this is for cholesterol. Kasi yung cholesterol din can somehow cause hypertension because of the narrowing of the arteries. Pero pag kumain ka at uminom ka ng bawang now, na mataas ang BP mo, hindi po bababa ang blood pressure mo because of the bawang. But it will help your cholesterol. Okay? So, you can use your garlic. Pwede po siyang sa ginisa. Mas magandang konti o walang mantika. And then, iniihaw din siya. And then, sometimes it's being blanched, no? Depende kung ano yung tolerance natin. But take note, this is a gastric irritant, so this may cause hyperacidity at the same time. So if you have doctors with you, you can also ask them on how to use this. And kung wala kayong access sa inyong mga doktor, if you want to use bawang to lower your cholesterol, make sure iinumin po siya or kakainin po siya together with meals, or you take it with full stomach, para hindi po siya trigger to develop hyperacidity. Okay, next here is bayabas, or we have guava. So, guava is proven effective as antibacterial. We use this panlinis sa sugat para po siya sa infection sa mga bibig. That's why ginagamit po yung decoction or pinakuluang bayabas pangmumog, okay? Kung meron tayong mga aptus ulcers, no? Meron po tayong mga singaw, ginagamit po siya. May mga magang gilagid, may sirang ngipin, no? Ginagamit po natin yung bayabas. And of course, ginagamit natin siya for disinfection dun sa mga sugat ng sugat, alright? So that means traditionally you will see yung pinakuluang bayabas kasi ginagamit talaga siya sa mga sugat. And now it is proven by the Department of Health that it is really helpful. Okay, next here is lagundi. So lagundi is commonly used and basically for hika or asthma. Ngayon, nakikita nyo lang na ina-advertise siya for cough. But basically, it was proven to be helpful with patients na may asthma o may hika. And it is also helpful for patients na may lagnat or fever. So, kung halimbawa, uminom ka na ng lagundi para sa iyong ubo, and then may kasamang lagnat yan, sometimes you won't need paracetamol anymore kasi may antipyretic property din siya. Now, sambong is found in the pharmacies already, but if you have plants of sambong, you take note of this lecture. Nilagay po natin dito kung paano nyo siya gagamitin. And this is how you can use it as home remedy. So basically, we let you take this for 5 days, and then after 5 to 7 days, then you can stop using this. Now remember, ang langgundi po ay what do you call this? Expectorant, pampaubo, pampalabas ng ating plema. So kapag ang ubo po ay dry, for example, wag po muna tayong iinom ng lagundi. Basically because it will allow you to expectorate, and then mahirap pa pong mag-expectorate, right? So you take more water. Meanwhile, no, na dry pa yung cough natin, you can do steam inhalation, for example. And you can do hot compress or hot fermentation, mainit na towel, no? That can help you as well before you even take your lagundi. And if you have access to your doctors, pwede din po magtanong kung pwede na pong mag-take ng lagundi. Alright? Or kung walang access sa doctor, pag pumunta po tayo sa pharmacy, yung ating mga pharmacists are also helpful, very, very helpful in giving you information kung paano po siya inumin. Kasi yung mga lagundi na available in the pharmacy are already formulated, depende po sa dose. The dose will depend on your age group. Okay, so kung ang gagamitin nyo po ay fresh lagundi galing sa inyong backyard, for example, or galing sa backyard ng inyong kapitbahay, ang gagamitin po natin formula ay yung nandito sa ating screen. So, kung merong lagundi yung ating kapitbahay, humingi na lang po sila ng pantanim para po hindi tayo hingi ng hingi every time na gagamit tayo. Okay, so next here is sambong. Like I said, this is one of the most famous among the 10 Philippine medicinal plants together with lagundi. And this is used as diuretic, pampaihi. Ginagamit ito sa mga pasyenteng may manas or may edema. Okay? And pampatunaw din po siya ng bato sa kidneys. Okay? So those na ginagamit natin, nasa screen po ito nakapost. Kung gagamitin po natin yung fresh na preparation. Now this comes in many different preparation. In the pharmacy, it comes in a tablet form. Meron pong capsule form, meron din pong tea form, okay? So all of those types of preparation can give you the result that you need and expecting from sambong. Pero yung mga sambong na coming from your backyards can also do the same. Okay, so just follow the instruction that we have here. So basically, hindi po kasi natin binibigay yung sambong sa mga pasyente na may tinitake na ibang gamot. So you have to tell your physicians kung ano yung mga iniinom ninyo. Kasi say for example, you're taking some form of antibiotics or some form of anti-steroidal pain relievers, or uminom po tayo ng ating mga steroids, and then you are diuresing with the use of sambong, pwede pong magkaroon ng interaction at yung effectivity ng ibang gamot na iniinom mo, pwede pong bumaba. Okay? So kaya kailangan po may consultation din po in cases like you have many maintenance medication. Okay, next here is Chang Gubat. So I know you're familiar with Chang Gubat. We usually use this for landscaping. Sa mga schools, nakikita din natin siya. No? We usually use this for landscaping. We form this in many different forms kasi magandang magandang ornamental plant siya. We thought it's only ornamental, but yes, it's medicinal at ginagamit po siya sa sakit sa tiyan. Okay, so kung paano po siya gamitin, again, decoction form, pinakukuluan po siya using the instructions that you can see in the screen. Okay, next here is ulasimang bato. Ulasimang bato, we sometimes call this pansit-pansitan. In Ilonggo, it's called sinaw-sinaw. Okay, so we use this to lower down uric acid. Basically, this is used for gouty arthritis or rheuma. Kung sa Tagalog, sa Ilonggo, rayuma din ang tawag. So you can eat this fresh. Like right now, maulan na po kasi tumutubo lang siya kahit saan, right? So sometimes you don't really need to plant this purposely unless kailangan mo talaga siyang padamihin. Because this is indigenous. Ibig sabihin, tumutubo lang siya. Depende sa season. Sometimes, kaya tinawag siyang ulasimang bato kasi tumutubo kahit sa bato. Sometimes, nasa mga paso, nakikita mo siya. Alright, so you can use this fresh, kinakain siya, kasama sa mga salads. Or you can also use this as decoction, pinapakuluan, using the instruction that we have in your screen. Okay, last two here, we have, second to the last is Yerba Buena. So your Yerba Buena or your mint, like I said earlier, sana po lahat ng pamilyang Pilipino may tanim na mint. Sandali lang po siya panamihin, right? Cuttings lang po, and then you can propagate easily. So this is used sa pananakit ng iba't ibang bahagi ng katawan. The Department of Health has proven this for pain, okay, as pain reliever. But in many different literatures, many different studies, is being used with carminative actions. Ang dami pong benefits that you can get from mint. Okay, so you can also notice even our shampoo has mint, right? Because of the soothing effect. Toothpaste has mint, for example. Many soap has mint. And then this is also used in culinary medicine. Ginagamit din po siya sa mga food preparation, in juices, because it improves taste. Again, it will help you expel gas because meron siyang carminative property, anti-flatulence property. Aside from the aside from analgesic effect, okay, para sa pain. And then lastly here we have niyog-niyogan. So I'm not really sure what is this called in Ilonggo, but in Tagalog this is called niyog-niyogan. Okay, so we use this as purgative, okay? Pangpurga, especially for ascaris, okay? So we have a parasite called ascaris, and basically we can use niyog-niyogan for that. Again, like I said, meron po siyang bunga, and yung bunga niya, meron pong seeds doon, and then those seeds taste like peanuts. So yun po ang pinapakain natin sa mga kabataan. And not only kids, because you also give this to adults. Okay? So hindi po kasi exempted yung adult, porque adult ka, wala ka ng parasite, no? That's not true. So sa matatanda, we give 8 to 10 seeds sa mga kabataan, edad siyam hanggang 12 years old, we give them 6 to 7 seeds. Okay? So, if mas mababa pa sa 4 years old yung pasyente, then you have to consult pediatrician already. Kasi pwede na po tayo magbigay nito sa bahay. This is basing on the guidelines na binigay ng Department of Health. 4 to 5 seeds sa 4 to 5 years old na bata. If this is lower than 4 years old, then kailangan nyo na po ng tulong ng pediatrician. Okay, but you also have to take note, kasi medyo masarap po yung seeds. Like I said, ang lasa niya po ay parang peanuts. So kapag nasobrahan po ng intake, sumobra dito sa rekomendasyon ng Department of Health, pwede pong magkaroon ng pagsakit ng tiyan, pwede pong mag-develop ng sinok or hiccups, and pwede rin pong mag-diarrhea. So just take it as prescribed, no? Wag po nating papasobrahan. Alright, so what do we need to take note in terms of herb utilization? It can be prepared in many different forms. Tulad ng sinabi ko kanina, infusion. Pag sinabing infusion, hindi mo kailangang pakuluan, right? Yung herbs. Infusion can be cold infusion or it can be hot infusion. So kung mainit na tubig ang ginagamit, you just have to put your herbs in the water, and that's it. Ang tawag natin doon ay infusion, just let it steep. Ito yung mga tinatawag natin na tea preparation. Okay, so how do you prepare your infusion? Nandito po sa inyong screen. You only need 25 grams of dried herbs or 50 grams of fresh herbs in your 500 ml of boiling water. Okay, next here is decoction. Ito po yung pinapakuluan. So there are herbs na you cannot extract the components kung hindi siya pakukuluan, no? Kung halimbawa if you just tip them in hot water, wala tayong halos makukuha. Now basically this is used for roots, for woody parts na kailangan mong ipakuluan. Okay, so decoction. So how do you do decoction? You can see the instruction in your screen. Basically, you just need more water here kasi kailangan mo ng simmering, no? Simmering means pagkatapos kumulo, bababaan mo na you lower the fire and then you let it simmer. And then we also have warm and cold compress that we use. Ito yung tinatawag natin traditionally tinatapal, okay? Or poultice, for example. Kung doon sa may mga sugat, directly, ina-apply natin doon sa mga areas. Sa mga may painful areas, directly, pinapatong natin. We also have ointment, okay? Yung ointment, this is to preserve the substance of the plant so that you can use it readily kung kailangan siya. So this is basically found in many department stores and grocery stores already, and usually ginagamit siya for external purposes, sa mga sugat, irritation of the skin, for example. Okay, and some of those are being utilized as cream as well. Now, how do you propagate these herbs? There are many ways to propagate our herbs. Basically, you can grow this coming from seeds, for example, or you can buy seedlings and then you just cut and then you propagate. There are many options on how you propagate them. Now, in terms of harvesting, timing is really everything. When you say timing is everything, we do not harvest na umulan, right? Because some of the substances are being washed out. So before it rains, make sure you harvest the herbs already, and make sure you have to leave 25% of your herbs so that they can grow, para tumubo uli siya and so it can give you more leaves, for example. Okay? And how do you process them? Mostly herbs are air dried, and if you have dehydrator, you can also use your dehydrator when you want to dry your herbs. Of course, before you dry your herbs, you have to wash them properly and you have to select the best herbs at yun yung ating ipipreserve. You can also do hang drying if you want. Kung ito yung mga nasa bahay lang natin, kasi usually when we harvest, may mga sobra-sobra tayo, pwede nyo po siyang ihang. Again, air dry. There should be a good ventilation at home para hindi po siya mag-develop ng any molds. But if you have a dehydrator, or if you have oven, for example, that can also help you dry your herbs and preserve your herbs. Now, say for example, you have many preserved herbs already. How do you get into livelihood, for example? Okay, so since these herbs are widely used in this generation, you can propagate, for example, seedlings, okay, fresh preparations. Yung seedlings kasi, marami sa atin, many of us would want to use fresh preparations, right? Pero hindi lahat marunong magtanim. And so you can start off marketing, for example, or propagating yung mga seedlings natin. You can sell it, depende kung gaano kalaki, from 50 pesos to 500 pesos. Kasi minsan, sensitive din yung ibang herbs, and then if it's already a mother plant, then you can give a good price for it. And then for example, these are dried herbs na. You can sell the dried herbs, for example, na ginagamit in tea preparation. Yung ating mga poultices, ginagamit din natin siya. Yung ating mga ointment, for example, and then the creams, you can also produce this and sell this in the market. Now, let me just remind you that if you wanted to go onto production of medicinal plants, yung mga process na po, you needed to process a permit, diba? Kasi the government wanted to make sure that what we are selling is safe for public consumption. So basically, there are many things that you need to know. The Department of Science and Technology is also offering free courses on that, on how do you go about production, and selling, of course, of your products. Alright, so practically that's it. The next section here will be showing you on how to do decoction, infusion, and other preparation of medicinal plants. I hope you learned something from our lecture today. Thank you very much. you.